Here's been part of this morning show for over 25 years. I certainly enjoy the weekly conversations about sports, medicine, the insight, what is being done. And that's my friend Dr. Joe Congini with us. He's even taken time through the years to rock my baby Rocco when he was little to keep him nice and quiet on that front. Joe, good morning, my friend. Thanks for joining us again this morning.
Yeah, sure, Ray. Good morning. One of the things I like to do on the show is just like what we do in the office. And so we've talked about these injuries when they happen, when they occur. We call it acutely. Mm-hmm. But then sometimes I like to go back and look at outcome studies, kind of like what's happened to some of the injuries that you and I have talked about. And there's three of them that were in the news with Cleveland Sport Figures this week, and I kind of wanted to review those three. Significant structural complex injuries, ligament injuries, post-op surgeries to some of our better players, and kind of what was the outcome. We talked about all these when they happened. The most recent one, number one that I want to talk about is Darius Garland.
Yeah.
He had surgery on Monday. You and I talked about it. We've been around a while, and we know, and I know how significant turf toe can be. And it had the sense that it looked like a bad case of turf toe. He just could not push off and explode off of that. And so many people minimize because it's the great toe. We knew that was going to happen. You and I talked about that. So many people say, hey, if he's good enough to play, shouldn't he be playing at a higher level? And a lot of the blame came down on him, which I thought was tremendously unfair as a sports medicine doc. I always protect my guys.
Yeah.
And looking in from the outside, I thought it was unfair. It obviously was a pretty bad injury. He had a pretty significant surgery done on Monday. This is going to be 4 to 5 months. Again, we're going to talk about the fact that it's a big, broad ligament below the great toe, and you use it so much in exploding sports where you're pushing off and lateral movement and everything like that, as you are so much in basketball, and especially so much in a player like a point guard like Darius Garland. We're not 100% sure that people get back all the way. Like everything else, surgery has improved since the day you and I threw out a couple names of people whose career were ended by turf toe. But it is a serious injury, and it obviously, I think when we looked at it a couple months ago, you and I were pretty right. It could end up with surgery.
Yeah.
And so we hope for the best for Darius Garland in the next 4 to 5 months. And I really don't know whether he'll be ready for the start of the season. We'll keep an eye on that as well as we kind of do outcome studies. Outcome studies number 2, Shane Bieber. Wow, what a dynamic young pitcher, Cy Young Award winner in 2020. Tears his UCL in April of 2024. We both have the love of baseball, and what a crafty pitcher and good pitcher with great stuff that Shane Bieber is, and could be so useful to the Guardians right now. And we thought he was on the recovery on the way back. One of the things about the recovery, we have specialists, PT specialists, that work just with throwers. And there's 5 parts of the rehab, and I won't bore you with the early parts. They're a lot like other injuries. But the 5th part is the functional throwing part, where we then start to say, okay, how we're going to vary the velocity and increase the velocity as we go. We're going to vary the number of pitches and the distance, and then we're going to have the person get up on the mound and throw. And we really don't know until they get up on the mound and throw where they are in the progress of this, and are they close to being ready to getting back or not. And obviously it was a disappointment this week when he got up on the mound. He threw one day. He felt good. His velocity and things were good, but he had discomfort and soreness, and we just don't know. Although people say he's going to throw again in June, these sometimes take longer than that. You know that the given time we talk about is 12 to 14 months, but many people get into that 16 to 18-month period too, and so we'll keep a close eye on Shane Bieber. And by the way, I want to mention, and I did when we talked about Bieber and others the first time, there is that newer surgery that we're using. I spoke with one of my surgeons yesterday for younger kids so that we don't do the full Tommy John, the 14 to 16 months surgery. It's using a surgical tape that we use, or a surgical brace in the elbow, and it really limits the time in half. But we really don't know in these young throwers, younger kids, to commit them to the full Tommy John surgery. And we're doing research on that, and the research is encouraging so far that this surgery that we use on younger throwers may really be something that's going to be helpful and another great advance in my career that I got to see. And speaking about great advances in a career that I got to see, the third person I wanted to talk about today, couldn't let this show go by without talking about the MVP of sports rehab, the role model, the GOAT of rehab, and that's Nick Chubb. I mean, to see what Nick Chubb's gone through, to know from sports medicine through a career of 40 years in the field of sports medicine, to see how hard he worked, what great attitude that he had. I didn't work with him specifically, but we all kind of looked in from the outside. And to know that it started with that terrible injury that he had. Thankfully, we don't see terrible triad a lot, but we talked about it a lot when it happened. That's 3 ligaments, cartilage damage often, nerve damage many cases. Many, many times athletes don't get back at all. He not only got back after his first terrible triad at Georgia, he got back to being arguably in the top 2 or 3 running backs in the National Football League, no doubt about it. And then doesn't he have to, a year and a half ago, almost 2 years ago, he goes through a terrible triad for a second time. Now, I've never seen somebody come back from 2 of these terrible triad injuries and get back on the field. He got back on the field. I know it's a performance sport, so you have to look to see what the performance is. But just getting back on the field tells me this MVP, this role model of athletes, we all just came to love him so much in the Cleveland area, and with him moving on to another team, and we'll watch him. I think we'll all wish him well and root for him wherever he goes. But I'm telling you, in the rehab world, there's very few like him, maybe 2 or 3 I've seen in my whole career. So I couldn't let this day go by without mentioning Nick Chubb.
Joe, one thing before I let you go this morning, you and I have spent many, many times and years talking about throwing injuries for pitchers. It's very difficult for these guys to battle back. The Guardians sent Bieber on down. They drove him from Cleveland down to Akron, gets up on the mound, as you mentioned, feels some discomfort the next morning. They were ready to go. Is that, and again, I'm not being specific with Shane Bieber, I'm just trying to look at the situation with you and your experience with sports medicine, some discomfort after throwing off the mound. Is that concerning, or can that be a natural part of the rehab to just back it up a little bit?
That's a great question without a really great answer, because there's no objective test. Like getting an MRI right now would not necessarily help you answer that at all. Or, so we love a great objective test. Hey, if we did a test and saw that he had looseness in the elbow or other things, there's just no great way to know. And so, of course, we don't like to see, and there's certain types of things that go with that soreness, like swelling or catching or locking, that we don't know anything about. So but it's all clinical. And so they'll take the month off, they'll go back to the drawing board, they'll start to rebuild him up again and go through that process I was telling you about, the 5 steps that they go through. They'll start out all over again, put him through those 5 steps, and when he gets to that last step of stepping up on the mound, we'll see how he does, how his stuff is, how his velocity is, and most importantly, does that soreness go away? If we get into having problems with that again, then sometimes we have to explore further. But unfortunately, I wish there was a more objective answer to give you with that. But it's certainly not rare to get there and just be a little bit earlier, and then it's 16 months or 18 months, he comes back. And many, many professional pitchers have had very good first or second years back after their UCL. So we have to hope he'll be in that category. We have to hope that for him and for the team that it be just a brief setback and not something that is going to be an ominous point that he's not going to be able to get back. It's not at that point at all yet, Ray, from the standpoint of the way you asked that question. But it's really hard objectively to know what category he's going to fall in.
All right. Sounds good, my friend, as always. Thank you for the insight, Joe. Always appreciate the time with me on Wednesday mornings.
All right, Ray. Great. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.